What are the negative effects of skipping meals? Over the last 10 years, I've had many patients come to me and say they've started skipping meals or intermittent fasting and they're trying to lose weight. I often wonder if they know all the facts and the dangers of fasting. It often seems like a straightforward and simple approach, but it doesn't always have the effects you're looking for. In fact, the idea of skipping meals has been around for thousands of years. Many cultures and religions practice fasting regularly. It's easy to think if we're eating less, we're automatically going to lose weight. Well, unfortunately, the human body is a lot more complicated and it's not a one-size-fits-all with fasting. There's lots of different factors at play which affects each one of us a bit differently. Sometimes skipping meals can even be counterproductive to your weight loss journey. The metabolic paradox. One of the most significant effects of losing weight is a slowdown in your metabolism. When you start skipping meals consistently and regularly and have a significant reduction in your calorie intake, your body senses this. Once it senses the lack of food, it enters survival mode. Your body then starts to conserve energy and slows down its calorie burning processes. This metabolic adaptation can make losing weight and weight loss even more challenging over time. It's important to point out this doesn't happen immediately. It's usually over time, and it also depends on how many calories you're consuming the rest of the time. Health risks of skipping meals. Regularly skipping meals doesn't just affect your metabolism. It can also lead to nutritional deficiencies and other changes in your body. Missing out on essential nutrients can have a wide range of consequences. Number 1, fluctuations in your blood sugar levels. I don't know about you, but I often get hangry. If I haven't eaten, I do notice I'm a little bit more cranky and it affects my energy levels. Decreased immune function. Lack of adequate nutrition can reduce your immune function. This makes you more susceptible to illnesses. Number 3, hormonal imbalances. Well, in your body, you have vital hormones at play when you're eating to regulate things like your hunger levels and your stress levels. Fasting could mean that these hormones become unbalanced, especially if you're fasting over long periods. And due to the changes in these hormones, it could also lead to overeating or binge eating when you do get to eat. If you're fasting to lose weight and you start binge eating when you are allowed to eat, this will counteract all the benefits of the fasting in the first place. So, the hormonal imbalances and fluctuations in hormone could lead to disruption of your natural circadian rhythm. This is the time that you wake up and you go to sleep and you're hungry. So, a disruption in the hormones can also disrupt your natural sequence. Mental health. Fluctuations in blood sugar levels will lead to changes in your mood, your energy levels, your concentration, impaired cognitive function. Your body needs glucose to start thinking, as your brain is a vital organ that needs glucose to work. If you're fasting or skipping meals, it might impair concentration, memory, and even productivity. I don't know about you, but if I have to make a difficult decision and I'm hungry or I've skipped meals and not eaten properly, I do find it much more difficult to make a difficult choice. If I know I'm at work and I have to have a difficult conversation with a patient or make a difficult diagnosis, I do make sure I've eaten to make sure I have all the reserves I need to think as clearly as possible. Reduction in muscle mass. If you're fasting regularly and you're not getting enough protein, it could lead to changes in muscle mass. Digestive issues. If you're skipping meals, you might be more likely to have irregular eating patterns and disrupt your digestive system. This could mean you're more likely to get reflux, constipation, even bloating. The psychological impact. The relationship between meal skipping and mental health is profound. These patterns can include obsessive thoughts about food, body image issues, and even a disordered perception of healthy eating. Over the last 10 years, I've had many patients who came to me and said they're trying intermittent fasting or they're skipping meals in order to lose weight. I remember once I had a 22-year-old girl who was a patient. She told me that she was keen to lose weight and had started to skip meals. She said it was working really well and she'd noticed some initial weight loss already. As I continued to follow her up, I noticed that she became increasingly obsessed with calorie intake and food consumption. She spent the majority of her day calculating calories and focused on her body image. This small habit that started off initially just to lose weight led to her developing a serious eating disorder over time and affecting her mental and physical health. After she was referred onwards to psychology as well as a nutritionist, they were able to support her to develop healthy eating patterns and a balanced diet once again. So it's incredibly important to be aware about the health implications of fasting, especially on your mental health and your eating patterns. The impact of skipping meals will depend on how long you've been doing it for, how many meals you skip, what the rest of your diet looks like, what your personal health history is. If you're elderly or a child, it's likely to have more negative consequences than if you're healthy in your 20s and you do it on occasion. In some ages, like if you are elderly or you already have a reduced BMI, having increased weight loss might lead to a wide range of health complications. Before you start fasting and skipping meals, it's important to take into account your personal health and what your end goal is. Is there another way you can lose weight, or what is the best form of weight loss for you? When to see a doctor. You've lost a lot of weight and you're noticing health complications such as bloating, constipation, headaches, or feeling increasingly tired. It's hard to manage your daily activities. You've noticed a significant change in your mood and you're finding you're increasingly thinking about food. When you shouldn't try fasting. It's important to speak to a doctor or a nutritionist before you start fasting for prolonged periods. Again, it will depend on whether you're doing it for 24 hours, for a meal on occasion, 72 hours, and your personal health. If you have conditions such as diabetes, high blood pressure, heart disease, you're elderly or you're on cancer treatment, or you have a reduced immune system, please speak to a doctor before you try fasting. The best way to lose weight. So, you've decided that you want to lose weight and you're wondering what the best method is? Well, you need to think about what the best way of being balanced and healthy is for you. How will you ensure the right nutrition, the right exercise, the right sleep to support you with your weight loss journey? Here are some of my personal tips for you. Making sure you have a balanced diet. Make sure you have enough fiber, protein, fat, and carbohydrate to support you on your weight loss journey. This will help release regular amounts of glucose in a sustained way to prevent you having spikes and feeling overly hungry or not having all your nutritional needs met. Making sure you have regular meals and you're not skipping or fasting on too many of your essential meals. This is to prevent a severe calorie restriction and entering starvation mode. Being mindful when you're eating, making sure you close off the TV or any distractions around you so you can really be present and enjoy your food and notice when you're getting full. Regular physical activity. It's really important to make sure you're getting enough physical activity to support your weight loss journey to help keep your body as strong as possible. Make sure you're drinking enough water. This is because it will help regulate your appetite and make sure you keep healthy as you lose weight. The positive effects of fasting. Although skipping meals excessively can be dangerous, having fasting or skipping an occasional meal or doing intermittent fasting is generally safe and can have many health benefits. Some potential benefits can be helping you lose weight, regulating your blood sugar levels. It can help fight chronic inflammation, boost heart health and regulate cholesterol, boost metabolism and brain function if you do it in healthy amounts. In summary, skipping meals can seem like a quick fix for weight loss. However, there's many hidden dangers if you do it too much and you don't have all your nutritional needs met. By understanding these risks and choosing to go about fasting and skipping meals in a healthier, sustainable way, you can help reduce some of these potential risks. Remember that it's your personal weight loss journey, and how are you going to create the best sustainable outcome for yourself? Please write a comment below about how you incorporate fasting into a healthy routine and I'll respond. Thank you. Thanks for watching The Traveling Duck.